Very good. Looks like we're live. Good afternoon. Welcome to the budget roundup for this week. And Lindsay, are you in charge now, or are we turning it over to Tim?
We'll turn it over to Tim.
Okay. Tim, you're in charge.
Good afternoon, Commissioners, and welcome to the final set of budget hearings for BoCC 2023 budget.
But we do have 2 or 3 meetings yet.
Lots more meetings, but this is the last presentation hearing stuff. And I will tell you that I heard loud and clear that you wanted to hear from department heads, and let me tell you, I agreed and I was happy about that, but we had a couple of circumstances that don't allow that. So I'll be presenting for ComCare and CDDO, but I've got Annette and Adrian here to present their departments. But I'd like to go ahead and start talking about Division of Public Services. Our mission is to promote health, wellness, independence, and improved functioning for individuals served. Today you're going to hear presentations about public services, community programs, the Department on Aging, Sedgwick County Developmental Disability Organization, ComCare, and the Health Department. And the division's strategic plan includes these 5 goals: to reduce the number of unserved members in our community in collaboration with community partners. We know that we're not going to be able to deliver all the services that folks need, so we know we have to partner with others. We want to amplify the information shared about the value of services and make sure that no one misses out on services because they don't know about them. We want to increase collaboration involving external and internal partners so we better serve the community. We want to enhance the culture of innovation, collaboration, and customer-centered service in our departments. And then we want to advance positive professional image of human services and the folks who deliver those services. I'm going to start out by talking about the community programs budget related to public services. This is one that you've seen a number of times before. This is for funding for the Child Advocacy Center. In 2021, the CAC was responsible for serving over 1,600 abused or neglected children, and almost 1,300 non-offending caregivers were served by the CAC. Their challenges and opportunities are ones that you've heard from others before. The pandemic has disrupted family life in a number of different ways, and one of the things that we know from history is that whenever there's an event like the pandemic, if there's the tornado, any kind of significant impact on individuals that disrupts their family life and their home life, creates long-term issues and spikes in things like abuse, neglect for children. And so we know that there will be coming additional work for the CAC. So increased demands are a concern for them. The funding that the county has provided has remained flat. They have engaged in a number of different fundraising activities, and they continue to seek funding from other organizations as well. But this does meet with that access and partnership goal that's in the strategic plan. The budget number for them is $205,000. It's been that number for a number of years now. Be happy to answer any questions about that one. If there are
no questions.
Okay, I'm going to turn it over to Annette and let her talk about aging.
Thank you. Afternoon, Annette.
Good afternoon, Commissioners. Annette Graham, Department on Aging. So I'll start with our workforce strength information. So you'll see a lot of different colors here. And I know you've seen these before. So red would be a 51 to 79% rate of employment. Green is 90% or greater. So we have varying across the different programs where we're at with vacancies and with openings. So this has been a continual process throughout the pandemic and during the last 2 years. we have seen significant and historic turnover in staff. We've had times during the pandemic when we would have positions be open for 6 months or longer, and some for even a year, and it had been really hard to fill positions. We had some positions that turned over twice during the 2-year. We had significant issues in our finance department where we didn't have our finance director left and took another position within the county. Then we filled that position. That person had some family concerns and had to go to a temporary part-time position. Our accountant had left. So we were...
Just a moment.
Oh, yes.
Commissioner Meitzner.
Yes.
And that, just because you've got so many color of the red, can you just, if you had to say what was the top area that you really have to worry about of all those red boxes?
The red boxes. At 51 to 79% would probably be the biggest issue has been in the Senior Care Act program.
Okay. I just wondered.
And in transportation. And I'm trying to find that. In our transportation program, that continues to be an issue. So that it's showing yellow, but that is a continual churn. Continual. And the issue there is that we work within the coordinated transit district, so we know and have done some research through our mobility manager, and we're at pretty much the lowest rate for driver reimbursement and pay in the 7-county region. So that is a continual churn. It's really hard we've had positions that have been open a year or more, so there's always a vacancy and there's always turnover. So transportation would really be our biggest issue that's kind of the ongoing issue.
Thank you for letting me interrupt.
Yeah. So you've caught us at a point where we're more fully staffed than we have been throughout the last 2 years. We've hit a situation where we've been able to fill positions more easily in the last 4 or 5 months. But at the same time, the bigger issue really that this doesn't really show you is the impact of that churn. So, for instance, when we started pre-pandemic, we had 42 staff people. We've also, and out of that, at this point in time, 20 of those original staff remain. So we've had that much turnover, and out of those, 15 of those, 5 of those people are in different positions. So the impact of that is that we have people in new positions, we have new staff, and that takes a lot of time, as you know, to onboard and to do the training and to cover those vacancies in the interim. So what happens is the remaining staff, or what sometimes we refer to as survivors, carry an extreme workload. So they're sometimes doing 2 or 3 additional jobs in addition to their jobs. So the unit directors that I have that report directly to me have had to cover frontline positions. So when I look at our call center, for example, that has been 100% turnover. When we look at our functional assessment, our assessments for the home and community-based services, that's been a 100% turnover. We have another one in our Senior Care Act program. 3 out of the 4 positions have turned over. So we have all these new staff, and it's just this excess workload that creates on the remaining staff, and that makes it really, really challenging. In addition, we've had increase in staffing. So in the year 2020, we had a 24% increase in staffing, in 21 a 4%, and in 2022 so far another 4%, because we've had additional funding coming into the department. So we've seen a pretty significant increase. So on top of the churn of the existing positions, we've also had new positions coming in that have had to be trained and educated and onboarded and go through all of that. So there's just been a lot of an extreme amount of new staff and training and changes that impact that. For instance, for those that report to me, I've added 3 positions that report directly to me. We've got maybe it was 4. We have a grant with the state for going home transition. He's an occupational therapist that helps transition people. He reports directly to me. We have a new mental health position that reports to me because I'm licensed clinical social worker in the department, so they report to me. We had a mobility manager that reports to me that serves that 7-county region. So we've just had an extreme amount of turnover and just the impact of that. And we do know that, with the wages the way they are, that also contributes to that turnover and to that churn, because and we've had trouble filling positions because people will interview and then they realize that there's not much wiggle room for the wages, so they don't take the jobs, or people leave the jobs because of the wages. So just kind of an example of the amount of churn. Just this week we had 1 retirement and 1 resignation and 1 new hire in 1 week. So that's just a lot of activity going on regarding to the employment picture. In addition, we've had some new programs that have started. So we have administrative case management that started back in May of 2020. So that's a new program with new staff. We had the mental health person, the mobility management person, and the grants transition program. And so those are just, addition on top of all of that, just some new program and new requirements and new activity going on with the funding that has come into the agency. And that will be expected to continue throughout till like September of 2024. So we'll continue to see some changes and new funding coming down, and you'll be seeing that in some future county commission meetings when I bring that in front of you, such as the Older Americans ARPA funding. So those movements will continue on, but and thank you, Commissioner Meitzner, for that question, because really that's probably that transportation. I know that we've talked about that before in lots of different venues about the need for transportation and the challenges with transportation, and for our department's provision of that pay rate for drivers is really problematic. Okay. So next we will go on to the next slide. Oh, wrong. I knew I'd get it wrong. So our strategic plan. The strategic plan was developed prior to the pandemic, so we've made some revisions in the wording to try to make it more pertinent, but it will continue to need some work as we come out of the pandemic and really begin to understand more fully the impact of the pandemic and the social isolation on those that we serve in our department. So strategic goal number 1 is a comprehensive coordinated system of care. And that really is focused on that older adults, caregivers, and people with disabilities have the information and resources needed to live and age with dignity and choice. This continues to be a really critical, important piece that we see is ongoing, that people don't know where to go. They don't know where to start when they need services. So when they're in that situation, that they need services for themselves, their family members, their loved ones, they don't know where to turn. So it's really important to help within our community to work with existing partners and with our own resources and staff to move forward with that in a partnership. Strategic goal number 2, housing. Older adults have safe and accessible housing needed to age in the community. Again, this is a problem and an issue that crosses all boundaries for all populations, the need for affordable and accessible housing. And what we see continually is that because of that lack of this resource, people often have to seek out higher levels of care. They're either going to have to go to a nursing home or assisted living if they can afford that, or some type of Homes Plus model. And those are often situations that people can't afford to pay for. So especially with the pandemic and the ongoing inflation, this continues to be an extremely critical issue that we continue to work with, and we'll be working with partners in the community to try to begin to move forward with this. And this is really pretty comprehensive, but this also includes things like minor home repair and home modifications. So if a person's in a hospital or in a rehab and they need to go home, but their home is not accessible, then how do we seek out the modifications to build a ramp or to make that home accessible, to make that more of an option for people to age in place? Transportation, to expand the availability and increase the coordination of transportation services for older adults, people with disabilities, and caregivers. So again, as I mentioned before, this is one of those cross-cutting issues, is transportation. It continues to be a challenge because the need keeps growing. The population is aging. Individuals with disabilities don't have access to transportation. The Wichita Public Transit serves in the Wichita area, the city limits. Then we have the General Rule Program that the Kansas Department of Transportation funds, but there's this, as we've talked before, kind of this donut around the city of Wichita that really isn't covered by the General Rule, and it isn't covered by the city of Wichita because they focus most of their services within that city limits area. So accessible transportation continues to be an issue. Wages is an issue, and providers. So we've been struggling to get providers to partner with us. We've seen businesses close. We've seen the impact of that. And one of the things we're doing with our mobility manager position that is funded by KDOT at this point in time for the rest of this year at 100% is to work on coordination, regional coordination, to work with all these multitude of other providers in this region to help coordinate, because most of the people that need intensive medical care or specialized treatment or hospitalization come into Wichita from this 7-county region and beyond. So the goal is to work on increasing the coordination, a more regional model, so that we can improve efficiency and increase the accessibility for individuals. Strategic goal number 4 is addressing the perception of aging and wellness. So this is really kind of related to ageism and just awareness in the community about aging and older adults and what situations they're living in. So to help understand that for the community and the general population and older adults and family members have to understand what the situations are, what's going on, so that we are better able to see what the needs are. And through that, we're also addressing ageism. So this was a big thing that came in on our strategic plan, the impact of ageism. The impact of aging is very pervasive, and it impacts both people's own internal ideas about aging and therefore our willingness to plan for our own aging and to help our family members plan for that, but also the awareness and ability for other entities, other government entities, other providers to rethink how they provide services. And if we can confront ageism, we know that healthcare will improve, services will improve, and funding will improve, because ageism impacts all of that. And this, when we did our strategic plan, it was a community forum. We had focus groups, and this was a big issue for many as they begin to look at the impact of ageism and how that, and during COVID and during the pandemic, this awareness was kind of heightened and a light was kind of shined on the impact of that on the circumstances of older adults. Our final strategic goal is chronic illness, mental health, and aging. So these are all intertwined. So the goal here is that community-based mental health services appropriately address the needs of older adults, and that healthcare services improve the quality of life and prolongs independence. So because of that intersection, it's going to be focused on working with professionals and entities and healthcare providers to really improve access and to improve the services and to educate more of the professionals on the specialized needs of older adults and their situations. So, challenges and opportunities for the department. We have received several rounds of COVID funding. So first we received CARES funding through the Older Americans Act, then 2 other rounds of funding similar to CARES funding that was specifically for nutrition. And then we have the Arpa federal funds. So the first 3 rounds of funding have pretty much been expended, and now we have the Arpa federal funds that are available through September of 2024. Challenges, that's one-time only funding and developing services and programs to address the impact of COVID and the pandemic on this older adult population, to address issues related that have been highlighted by that. These are guided by the Older Americans Act, and the services in there include home and community-based services, the 2 nutrition programs, in-home and home delivered, disease prevention, health promotion, and the family caregiver program. So there's some template for how we can allocate those funds. And then the other thing that happened was that there was a required match for that fund that the state then came to us about a month and a half ago and said they had state dollars that they would provide that match money. And it was close to $400,000, but the catch was we had to be able to expend that by the end of June and work with our nutrition providers. So that was quite a bit of money. So, and then there's some other money likely coming down from KDADS to the department for some workforce initiatives and some ongoing transition programming. But what we see is this will be a challenge when we come to the end of September of 2024, when we go back to those much lower amounts of funding. At the same time, what we know has happened is as COVID has impacted older adults disproportionately, more people are now aware of services, are needing services, they have more complex needs. So those needs you can't put the genie back in the bottle. So we'll be dealing with people's excess needs and desires for services at the same time that money reduces back down. And as you know, and we've talked about for several years now, that continual growth in the population age 60 and older, we continue to age, we all do, and people are living longer. So we're seeing a lot of growth in the age 85 plus that are more likely to present with more complex needs and need more services and have less family supports available. The ongoing workforce shortages and the increased cost of doing business. When monies go back to the lower rate, we'll still have increased cost. We know that working with our nutrition providers, they're saying our costs have gone up significantly. The cost of food, the cost of delivering, the cost of equipment. So if there's not an increase in funding, what we'll see is less services being available with the remaining amount of money. Opportunities for change and innovation. It is an opportunity to have this new funding and figure out new models of doing services, new programming opportunities and service delivery models. It gives us the chance to kind of test things out and see how we can do things better, more effectively to meet the changing needs of this population. They have changed both as the older adults themselves change, but also the impact of the pandemic. The impact of social isolation on older adults, the impact of ongoing stress, the impact of loss of loved ones, the impact of new heightened fears about nursing home placement and more people choosing to remain in the community and avoid nursing homes. Another opportunity is just utilizing the technology to address social isolation and diversification of services and how we do that. And here's our budget. You can see that there is the one item in red, and that is the commodities, and that really is related to the additional COVID and CARES funding that we had that was spent on contractuals commodities. So with that, I would be happy to answer any questions.
Commissioner Cruz.
Thank you, Chairman. Thank you, Annette, for being here today and sharing that with us. A couple of questions would be the home repair. What's the budget set for home repair?
I don't have that number. It is a combination. We have money in the Senior Care Act, which is a state-funded program. We have money in the Older Americans Act. We also have mill levy funding. So there's a variety of sources. Our Senior Care Act program year starts July 1. So every year we establish what that budget is. So it is, I can get you that information. I don't have that with me today, but it is a combination of multiple funding sources that go into that.
Okay, and where would someone find that on our website?
The funding for that,
How would they know how to ask for that? How would they know that that's a service that's available? I don't see it anywhere on here. That's why this
Okay.
isn't a gotcha. I'm
Right.
really trying to ask.
and it might be on our CPAAA website where we list more services.
Okay, so I wonder if there would be a way for us to list that on the available services here, because I just had a question about that last Saturday of a woman, and I wonder how are we advertising that service available? So if someone's in the hospital, they've had a physical disability now, they're not able to walk up the steps to their home. Are we working with social workers in hospitals to allow or to give information that we do offer this service?
We do reach out to a network of aging service providers, including the social work transition case managers, to provide them information on the variety of services that we have, because there's a multitude of services.
Okay.
So we do reach out and provide them information and education and really work to get out our 855-200-2372, the one call center, so that people can call there and talk about what their situation and identified needs. And we get a lot of professionals that call us through there. It has been slow spending that funding throughout the pandemic. We're kind of coming out the other side now, working on a waiting list. So for quite a long time, older adults didn't want anybody coming in their house to provide services. And at the same time, we were challenged with finding providers that would be willing to go in the homes and do those services. Additionally, because of our funding is limited and capped, for the amount that's expended, the jobs tend to be smaller jobs. So a lot of times it's hard to find vendors that want to do a smaller job. But we are right at this point in time kind of revisiting that, looking at how we can expand that cap and really better defining what kind of jobs we'll do, like small electrical jobs, small plumbing jobs, ramps, some minor home modifications like putting in grab bars, things like that. But we do have some information, and we do get that out to our network of providers and partners.
Okay, so I'd be interested in seeing what sort of resources you do provide to the community to make them aware of this program. And then I'd also like to see a snapshot of time of the 3 funding sources and what all it includes, how much it is in that bucket of money, and then how many people have we serviced? What amount of years do you think that you'd be able to get to me? Would that can I have a 3-year span?
We can look on that, yeah.
Yeah. Okay, so I'm looking for the Senior Care Act, the Older Americans Act, and then what was the other one?
Mill levy.
Mill levy. Okay. So if you could get me 3 years worth of that data, what it totals up to, and how many people were utilized it, and then what you're giving out to the community to make them aware of this program.
Okay.
Okay, and then the other thing would be the transportation. Have we thought about possibly putting together a electronic scheduling system? Or do people just have to call? Like if they know, that they're going to need a ride. I had a mother call me. Her son needs a ride every week. Same time, same place. And so she's told that she has to call every week and get a call or get on the schedule. So is there a way that we could do this electronically that could eliminate the need for staff to answer the phone? If we could have them go online and do this. Have we looked into that?
I know that we have a management information system and a scheduling system, but it is people staffed. And part of the issue is we don't kind of schedule ongoing. We have a certain number of rides we can provide every month. So we kind of have, it's kind of a first come, first serve basis. And we have been extremely challenged within the last several months because we at this point have no providers that will help us do the service. So historically, we've had a mix. We provide services with our vehicles and our drivers, and then we contract out some. That's just always been the mix. Reimbursement rates were pretty low. We've put out 3 different RFPs, and our providers have not responded to the RFP. So we were having a meeting with the community providers to say, how can we help you to respond to this RFP? What is the challenge? What is the issue? One of our biggest providers was the cab company. And I think it was just last week the cab company said, we're not going to provide any more rides for your clientele or any of your referrals until you raise your rates. So we are really limited. And again, with the staff shortage of drivers, and we've had drivers, so it has been a real challenge, and we did, address that issue and work with that woman, but it has been problems getting all of that scheduled when we just have our service only. And if they're within the city limits or within that donut area, our KDOT vehicles, the vehicles that are funded by KDOT, are very strict restrictions on how we can use that vehicle. Like, you can't use it within city limits. You can use it from outside in the rural area coming in and going back out, but you can't initiate. It is cumbersome.
Okay, so back to the scheduling of the scheduling system.
I can look into that.
I'd like to see even if you can't pre-schedule it, if you have to schedule it every single week, is there a way that parents or guardians or individuals could log in on a Monday and schedule a ride, and if all of the rides are full, then they wouldn't be able to schedule it?
Right. I'll look into that.
Okay, so the $230,000 that's left in that contingency fund, perhaps that could be utilized to fund something like this. So when do you think, what would be a realistic time frame in which you could bring that back to us?
The cost for an electronic scheduling system?
Looking at figuring out a way to improve the scheduling system. Yes, with it be an electronic system. Yes, that's exactly what my question is. When do you think that you can have that to us?
Probably in a couple of weeks.
Okay.
I think my staff people should know kind of about what those resources are and what those kind of systems look like and cost, and if that would be workable.
Okay, so then my very last question would be, that remaining contingency fund, there has been some other questions around what is your staff doing to hear from the community and their ideas around that remaining contingency fund?
We have talked about that at our last advisory council meeting, and then transportation came up again, and we talked internally about how we could address the transportation issue, and one option that we discussed was the purchase of a vehicle that would be more flexible in use because it wouldn't be restricted with those KDOT guidelines. We've also talked more about increasing the amounts for the hearing aids and vision, but we did not go out really to the community. We went out to had talked several times with our advisory council and asked them for their feedback and input about what they were seeing as the needs to try to kind of utilize their their awareness, them as the eyes and ears for the community.
So the $40,000 that was allocated for hearing aids, did you have a cap on the limit in which each individual could have?
We had not dug down to those details, and as I said, that amount could be increased. We did look at kind of the cost, and we did find that Costco does have hearing aids for $1,795. We thought that might be an option. Now, you do have to be a member, but we thought if that was approved by the commission, we could reach out to Costco and see if that we could get a departmental membership and do it that way, or maybe just add on another $60 for the $1,795 and get a membership for each individual. I don't know. We just haven't dug down further into that until we heard back from the commission about which way to go.
I guess that just makes me wonder why the $40,000 was, what was the limit of that, and how you went about putting numbers.
It was just an amount. Yeah.
So there wasn't any data or any calls that said, hey, we're seeing a lot of calls for hearing aids?
Our advisory council brought up the topic of hearing aids, and we know that hearing aids are not covered by Medicare, and they're not covered by Medicaid, and they're not covered by many private health insurances. So we looked at the data about how many older adults. I think one in every 3 individuals age 65 and older have a hearing impairment. And we know that the cost of hearing aids are quite expensive, so it was a starting amount.
Sure. Well, and thank you for that. So I look forward to receiving this info. Thank you for being here today.
Thank you. Commissioner Howell?
Thank you, Mr. Chairman. So you made some comments during your presentation about hiring some staff in 2020, 2021, and 2022. What were those numbers again? Or at least FTEs increased, I guess?
It was a 24% increase in 2020, 4% in 2021, and 4% in 2022 so far.
Are those filled positions, or are those just FTE?
Some of them are filled, and some of them are FTEs. And we do have more positions that are on the table that haven't been filled. And that is really based on capacity. We haven't had the administrative capacity because we were filling other positions and doing the training. So we're looking forward, as we're now more fully staffed, to be able to bring those positions in place.
32% increase in those 3 years. That's roughly a third. What are these folks doing? I mean, what services have we added to the Department of Aging as a response to these 1/3?
We had the mental health and aging position, so providing counseling, group therapy, in-home, telehealth, and in person. We had, and in office. We had the ADRC grants transition. That is the person helping older adults and anybody of any age, really, that wants to move out of the nursing home back to the community. That was a statewide program, so that was a position. We had the mobility manager position that is funded by KDOT and housed in the county Department on Aging because we administer the CTD. And we've had some quality assurance positions. We've had 2 new case manager positions. We've got another finance position that we were going to be adding on to help with all the extra data entry. We've had some kind of part-time or temporary positions doing some work with some of the new programming we've done. So we've done some food boxes and some health and safety boxes. We've done vaccination support, coordination. We've done some yard work last year, so we coordinated that. We've had some staffing come on to help with some senior center survey and data analysis work. So there's a wide variety.
Are these related to CARES or ARPA funding because of the years that you talked about? I'm just curious if these are...
A lot of them are, but we also had a significant increase in last year Senior Care Act program, so we added 3 or 4 new positions with that. There was a $3 million increase statewide for the Senior Care Act. That was a significant increase. That program had been at $7 million, so $3 million, and we typically get around 21% of the statewide funding for our region.
So going back to your org chart that shows the missing staff, does this include these 32% increase in staff? Does this org chart include those positions?
Yes.
It does. So we have a lot of openings. We're missing 13 FTEs. So we must not be yes.
So some of those are the ones that we have not been able to pursue getting filled yet because of the capacity and staff. We can only train so many staff at a time, and because they've been, some of those are some brand new positions, and they'll really have to work with a new staff person coming in to fully develop that and help get that up and running.
So we may not be providing some services that we desire because we don't have enough people to provide those services. Is that what we say here?
Yes.
Okay. I happen to notice that on the long sheet, we see a bump of 0.482 mils in current year. Is that including the $500,000 contingency numbers that we know? How did they get to 0.48? Because it wasn't that number last year when we passed the budget. So it's a higher number now than it was. Does this include some of these grant funds from Arpa and CARES? Is how that got bigger? I mean, how'd that happen?
So the mill levy rate would not get larger because of
Right.
any grant dollars. So looking at the long sheet, sorry, I gotta put my glasses on. We are at 0.482 for this current year based on the technically adjusted rate that was approved last year, and then it went up a bit. And then for next year, what we have in the forecast at this time is the 0.351, but I can assure you that will change because we haven't figured out all of the compensation and how all of those things may work. So that will likely see a change. Plus, we don't have final values yet.
Okay. And then to Commissioner Cruz's line of questioning there, some of the things we use with that contingency fund, if it's one-time spending like hearing aids, I think that's a great choice. I'm a little concerned about doing things like transportation because that sets us up for an infusion of money to just do something great, but that's a very one-time money. So I don't know what you do with that after that money runs out. We have a problem then. So it seems like that money, because it's a contingency funds, it really should not be for operations. It should be for one-time spending. You're welcome to comment. I'm just curious. Is that one of the criteria when we look at those funds, how we're spending those funds?
Yes, one time only, and one time only that had to be expended during this calendar year. So that does kind of challenge it. But the vehicle, if we purchase, if that is an option that I want to consider, then that would we already have drivers. It would just make that vehicle one that we could use in a more flexible way. And better meet the needs in some of the other areas that the KDOT funded vehicles do not allow. They very much limit how we can use those. As far as an electronic scheduling system, we would have to look, are there ongoing costs with that?
And this, I'll give up probably my final comment, but that $40,000 is just do the math. It's about 20 people who benefit from this. It's out of the population of 526,000 people, and I don't know how many of them are 65 and older, let's just say. How many of those folks have hearing problems and have financial challenges? I'm sure there's going to be a lot more than 20. So how do you pick the 20? Are these income qualified folks, or do they have to apply for it? And how do you pick the 20?
As I said, we're very open to increasing that. I guess we were kind of being conservative. It was up to $500,000, so we were just kind of being conservative with the request. We're very open to increasing that to whatever the commission would like to, and we can, would be ready to move forward with that.
So out of the 500,000, there's some money left over that's not been allocated to anything at this point?
Exactly.
How much has not been allocated?
230.
Well, nothing's been allocated yet. There has been no approval yet. I think the request that came through was $180,000, but that can be modified and increased up to, if it was a vehicle, if a vehicle is added, that's $130,000. The electronic scheduling system, I'm not sure what that cost would be. So depending on what the will of the commission is, we could increase in any of those areas up to the $500,000, amount that was.
I guess if there's a need
indicated.
for things like hearing aids in the community, I hope that we look at that, because that's what that money should be used for, in my opinion. But, all right, thank you, Chairman.
Thank you. Commissioner Cruz?
Thank you. I just have a couple of comments. The scheduling system would be, I don't know how much those things cost, but an upfront cost, of course, would be appropriate. But a vehicle is not just a one-time fee. I mean, we all know that. We all have cars. There's maintenance that goes into that, just like a scheduling system would be. So yeah, you're going to have your upfront cost, but the thing about a scheduling system is if it will save time for our staff to have to not be on the phone with someone to already schedule something, that's going to save staff time in the long run. So there are going to be some cost saving measures, not to mention the time it takes for our constituents to call in to schedule these as well. So I think when we're talking ongoing maintenance, a vehicle would have ongoing maintenance. So thank you for that.
Thank you. Well, I don't see any other questions, but I want to remind the commission that what we're talking about is the 2023 budget, and almost all the discussion so far has been about the current budget. So please make sure that we focus on what we're trying to do is pass a budget for 2023. And Tim, who's briefing CDDO? Are you briefing it?
I'll do that, yeah. I guess one of the things I want to point out is that as I was sitting here thinking, in the, 12 or 15 years that I've supervised department heads, I had one turnover that wasn't related to a retirement. And in the last 6 months now, I've had two specifically tied to compensation. And so, as you've heard from everyone, and you'll hear from me multiple times before I'm done, compensation is an issue for us as an organization. So I'm going to cover CDDO after that little prelude. Their workforce strength is different. Oftentimes, as I've briefed commissioners in budget hearings, the models are different across the human services array. The CDDO is a broker of services, so they don't have direct service providers. They do assessments and evaluations and referrals and connect people to services, and services are provided by the community network of service providers. So it's a small department. They're in fairly good shape in terms of their status. They've been holding some vacancies. All of these positions are state funded, so there's no local funding going into CDDO positions. One vacancy is not in this list, and it's the vacancy that's most important to me right now, but we'll get that resolved going forward as well. So they are facing some challenges from staffing as well. They have a strategic plan that focuses on communications. Their first strategic goal is related to communications, and again, making sure that both internally and externally their communications are clear and appropriate, and that the community understands the services that are available through the CDDO. Their second strategic goal relates to process improvement, and they are constantly looking for efficiency and effectiveness in the operations of their department. I will tell you that they are one of the departments that through the pandemic realized that they didn't need to be office-based. They are able to deliver services in the community where folks are. They've really adapted to that, and they have been able to give up the physical office space that they have because they're meeting people in the community and delivering services in the community. They are working through their strategic plan to empower their staff and their community, and they're focused primarily on trauma-informed service delivery. Dee and her staff have done a lot of really good work around trauma-informed care, and it makes a difference, particularly the population that they're serving. And then there's a significant focus within the CDDO on leadership and making sure that they are able to exercise leadership where they are, and they are involved in many different statewide projects and engaged in the state level in a number of different ways. And Dee in particular has led around workforce issues and training and some apprenticeship programs and things like that. So they do really embody the KLC leadership principles in an excellent way. From that 5-year horizon, challenges and opportunities, the number of individuals that are eligible for IDD program services continues to increase. Waiting lists increase as well with that. And community capacity, the ability to deliver those direct services is the biggest challenge on the horizon. There are workforce shortages across the country of direct service providers, DSPs as they're known. And so those are the folks that are working at organizations, large organizations like Ketch and Starkey. And then there's also organizations that may be 1 or 2 staff people caring for 2 or 3 different individuals. But across the board, across the country, there is a workforce shortage of DSPs. And so that's a significant concern. The work gets more and more complex, and the ability for that network to be stable is critical for individuals served as well. Again, that workforce shortage is a concern, and one of the biggest concerns is that disruption in service providers for individuals receiving care. DSPs develop relationships with the patients that they work with, the consumers they work with, and every time there's a change in that regard, it's a disruption to that service relationship. And it's not uncommon for DSPs to be paid $9 or $10 an hour. And so at that rate, that's one of the things that generates that churn. Fortunately, the state budget for the 2023 fiscal year includes an increase for service providers, and so hopefully we'll see some stability develop within that workforce. The CDDO is the reason that workforce stability is important and network stability is important is because the CDDO is required to assure service provision and there be a network of providers. In Sedgwick County, we have been able to manage that network of between 45 and sometimes up to 60 different providers to make sure that service provision needs are met. In the event that there is not an adequate service provider network, the CDDO would be obligated to find ways to deliver services, and how that's happened in many other communities is that the CDDO hires staff to do service provision as well, and we would certainly rather not get into that situation. Budget request for 2023 for the CDDO is $5,271,374, and I would be happy to answer any CDDO questions you may have.
Thank you, Tim. One thing I should have asked Justin and Jessica the other day is one of our legislative agenda items was reduce the amount of time it takes to get someone started with the services. And I didn't ask that question. Do we need to put it back on our 2023 legislative agenda, or where did it go?
I think it's probably not a bad idea to leave it on there. I believe that the thought process of the legislature that just or is convening or wrapping up right now is that the increase in the additional funding for the network of service providers will allow them to hire more people and retain more people, and that should shorten the time that people are on the waiting list. But I think I'll need to verify with Dee, but I think we need to probably leave that on there long term. Again, because the waiting list is significant. Some folks are on that waiting list for more than between 5 and 10 years often, and so we'd like to get that down.
Very good. Thank you. I don't see any other questions. Are
Okay.
you briefing ComCare?
I absolutely am.
Well, all right.
And this is another troubling workforce demonstration here. And I thought about putting together all the numbers because ComCare is in such a difficult situation. If we looked at the whole division across the 4 different departments, we'd be red across the board, red or purple across the board. There is one area where they're between at 92%, and that's in their admin and operations section. But all of their service provider areas, they are significantly short in terms of staff. And you can see children's services, more than half of the positions are vacant in their children's services program. We've lost med service providers for also the first time in many, many years. We've lost some providers to other organizations as well. And that will be a recurring theme as I talk about both the strategic plan and the challenges and opportunities for ComCare. So their strategic plan identifies 5 different goals, and one is to focus on patient populations that may be underserved. And the way they want to address that is to work with the state of Kansas and other data resources to make sure that we understand where disparities exist in our community, and then focus targeted attention on those areas and make sure, again, that people understand that services are available and how to access those services. So that's their goal number 1. Goal number 2 is to develop an internal and external storyboard that helps tell that story. We've talked before about CCBHC certification, and we'll be talking to you again next week about CCBHC certification. But there is a very heavy data analysis component tied to CCBHC status, and we'll use that data to help tell the community about the services and how we're doing with those services with some kind of a storyboard and a dashboard. Strategic goal number 3 relates again to enhanced partnerships to increase access to services. The staffing challenges that we have really lead us to look to partners as well to make sure that we continue to deliver services. We've got a lot of really interesting, good stuff going on. CCBHC status is one, 988 implementation is another. And we're looking at different mobile crisis models. We've got our current mobile crisis system. We've got ICT-1. We're looking at a model in Austin right now, and there's a couple other communities that have different models. We're looking at all of those things to try and figure out how's the best way to get mobile services out into the community. Strategic goal number 4 is to embrace evidence-based practices through competency-based trainings and initiatives. ComCare and their service providers are delivering specialized health care, and we've got folks that are medical doctors that are delivering that health care. We've got master's level licensed clinicians that do that. We've got case managers and care coordinators and peer support staff. But we need to make sure that we've got cutting edge current training for all of those staff, and make sure that we're using all of the best tools available to deliver services. And again, evidence-based practices are the gold standard, and those are the types of things that we want to focus on as we design service delivery for folks. And then the last goal relates to enriching pride and engagement among the workforce. I got to tell you, the last 2.5 years have been rough on everybody, but they've been particularly difficult for ComCare and those providers there. The pandemic really increased the number of people seeking services. Folks that were seeking services may have been more symptomatic than prior to that, and so there's been a significant challenge for our workforce to address the needs of the community. And we want to make sure that we've got a good work environment for folks so that they are healthy and able to deliver services to people who need the help. The 5-year horizon, challenges and opportunities, they're all intertwined, and they're all going to relate one way or another to workforce. And so that workforce shortage is their first challenge that they've identified. Again, not only at ComCare, not only in Sedgwick County, not only in Kansas, across the country, there is a shortage of behavioral health professionals, and fewer clinicians available makes that a much more competitive environment for everybody. If you're a clinician, if you're licensed to be able to provide services, you are wanted by a number of different providers on any given day. Our staff routinely get emails and postcards and that sort of thing from other organizations trying to lure them away from us. One of the reasons that we are vulnerable in that regard ties back to staff salaries, and we know that we are not yet competitive with the market, and this is one of those markets it's hard to catch up with because it is constantly changing. It's one of those red hot markets, and it's hard for us to keep up. We are encouraged that the new payment model for CCBHCs should allow us to be able to enhance our salaries and be able to then recruit and retain at a better rate going forward. But when we have shortages, it has caseload impact. And so that caseload impact then leads to more burnout and that sort of thing. So large caseload side is a significant challenge for the department. And one of the things they've done in response is this all hands on deck response. Annette mentioned that she's got management team that are doing staff line work. That's happening at ComCare as well. There are shifts 24 hours a day, 7 days a week, where folks need behavioral health services, and it's hard to get all those shifts covered. And so we've got managers and directors covering shifts all throughout the course of the day, and they're putting out fires. One of the things that Annette talked a little bit about having new staff is, and so as we fill vacancies, as we hire folks brand new, they don't necessarily have the experience for some of the things that they're encountering, and so they rely on their supervisors much more than an experienced workforce would have. So when you've got a workforce where many of your employees have been here for 2 years or less, it creates an additional burden on your managers and supervisors. The other thing that is challenging for us is this increased demand in services. Youth hospitalizations are up 225% since the beginning of the pandemic. And as I mentioned before, folks that are seeking services are demonstrating a greater level of need, which again puts pressure on staff in general, new staff in particular. And so that has also resulted in, for the first time ever, some wait lists and some referral, particularly of children's services. That's not been typical for us, but we're challenged to meet the needs of the community, and so we're working with other partners to try and make sure that folks get access to services. There are some real positives going on too. One of those is that certification that ComCare received to be a CCBHC. It changes the service provision model. It goes from what you and I are used to with our insurance as a fee-for-service model. We go see a provider, whether it's a physician or a physical therapist or anyone else. There's a rate that's paid by the insurance company for that one service unit. CCBHC creates a model where it's more comprehensive care. We are responsible for all of the care. It may be through referrals to other physical providers, but if you are a CCBHC member at ComCare, they're going to be evaluating and assessing lots of different healthcare needs, because we know that physical health and behavioral health are interrelated. And so CCBHC creates an opportunity for better care for individuals. It allows us, the additional funding allows us to implement models of care that we haven't been able to implement in the past due to cost. And so it's very exciting. It's a great opportunity. It's going to result in better care for folks. The implementation of 988 is now 2 months away. So on July 16th, the 988 number will be turned on nationally. And so anyone seeking behavioral health crisis services can dial those 3 digits and get connected to a trained professional to help them respond to the crisis that they're in. ComCare currently answers the 800 number, the Lifeline number, and there will be 2 additional centers in Kansas now as 988 response call centers, and so our actual response area is going to become smaller. So we'll answer calls that come to the 316 area code, and that allows us to really focus in on partners and community resources and assets that people can engage in. May be appropriate for someone to come into our crisis center, but there may be other resources that our call takers are going to be aware of, and they'll be able to work with people that are calling in and making sure that they get the services that they need. We know that the call volume is going to go up. We don't know yet how much the call volume is going to go up. We assume that we're going to need to hire more staff, and so that's why it's really critical that budget gets addressed during Sine Die, that gets funded as well. And then we're still in the process of planning that crisis move where we consolidate 3 different locations into one and be able to deliver greater services to the community and meet their needs. Budget request for ComCare, $51.7 million. That's down a little bit. Part of the reduction is related to some CCBHC grant funding, some demonstration grant funding that they've received that goes away. There are 3 different decision packages from ComCare. First one is a Grow Your Own educational program that was submitted as an Arpa request as well. And given the shortage of licensed providers in the community and across the country, we recognize that we need to be able to help folks transition from where they're at. So those integrated care specialists that are bachelor's level folks, help them get licensed at a higher level, whether it's through a master's degree or a substance abuse counselor license. We want to help our staff get that higher level of education that allows them to be licensed at a higher level. And so this model was built around, similar to the EMT to paramedic model in EMS right now. $280,000 is what we've requested for 2023, and we'll see how that goes. I think that's going to get us somewhere, if we are able to fill all the slots, somewhere between 7 and 12 to 15 different providers after a year or 2 years, depending on where they're at and the type of bachelor's degree that they have. Second decision package is a workforce market adjustment. So the department has been working diligently with finance and HR. We know that we need to do something about salaries for our providers. And one of the things that we also know is that because we've got CCBHC status and that the change in payment model, there's additional resources available to pay for staff. And so we're working with, as I mentioned, HR and finance to come up with a new compensation plan that's going to help us attract and retain folks going forward. The price tag on that is tentatively at $4 million, and we think that that would make a significant difference in terms of recruitment and retention. And the third decision package is a staff safety request. So we are seeing increased concerns about safety. So we've done extensive surveying with both people who've left and people who are still with the organization. And the number one reason to leave or consider leaving is pay. And another reason that comes up routinely is safety and concerns about safety. And so we want to make sure that we enhance the safety environment for our workforce, including some GPS anywhere, some tools that people can take with them so that they can notify people if they get in trouble. And then we'd also like to convert our security staff to commission level officers so that we, at our 24/7 facilities, so that our staff are safe at work. And the price tag on that is $710,000. So the decision package summary is $4.9 million. These requests are all to the ComCare Revenue Fund, their grant fund, and so these are not impacts on the general fund. It's a request for increased spending authority. And I'd be happy to answer any questions about the decision packages or anything else about ComCare.
Well, thank you. On your first decision package, that's for 12 to 15 individuals.
7 to 15, somewhere in that range.
7 to 15.
It depends on the type of bachelor's degree that they have. There are advanced standing programs, again, based on the bachelor's degree that they have.
Okay, but that was also submitted through ARPA, and that's only one-time money. Wouldn't you need this to continue after 2023?
Yeah, absolutely. But if it works, we're adding to the workforce, we're generating additional revenue, and it perpetuates itself. So, absolutely. Yeah, I think this is going to be, I hope that this is a long-term solution. I hope we turn some folks around quickly, but then it becomes a long-term solution for the workforce issues that we're dealing with.
I like helping get people educated and being able to advance in their job. The decision package number 2 is also one-time money if you get it through ARPA. And I guess I'm a little confused on
Same
what
premise. if we get that money up, the request for ARPA was if we get that money up front, we would be able to hire more people and retain more people. Having more service providers allows us to deliver more services, which generates additional revenue. So again, it's self-perpetuating. It would have been nice to have ARPA funding to kick us off as seed money for that.
Hey, won't they, hopefully what Sheena brings us, where we start increasing pay and we start reclassifying a bunch of people, isn't that going to help us also?
I think it will help some. We are significantly short pay-wise across the community right now.
I know you are. We've got to figure out a solution to it, but I just, using $4 million of one-time money, I don't know that that's going to solve the long-term problem. We've got to get the pay ranges up to where that we continue to keep people.
Agree, yeah. And again, we've changed the format of the presentation a little bit. You've heard me talk many, many times about the different funding models for the different departments across the division. ComCare's general fund of their total budget is roughly 10%. So they generate revenue, or they have either through the fee-for-service model that they've been in, or moving forward the CCBHC payment model, plus contracts and some grants from the state. And so if we could have received one-time funding through the ARPA process to get this payroll started, we believe that it would perpetuate revenue going forward.
Very good. Commissioner Howell.
Thank you, Mr. Chairman. I think I just figured out one of the answers to my questions, but one of the last things you said was you asking for increased spending authority. You're not asking for anything to hit the general fund. Can you explain that again? I know some of these things are ARPA funds, but
if it's not ARPA funded, and I'm not going to say don't fund it with ARPA funds, but if it's not funded with ARPA funding, this would come from ComCare's revenue generating side of the organization. So they would generate the revenue for these. It's not an impact on there may be a slight impact on this pay package because some provider positions are general fund funded, but again, the bulk of them are revenue funded.
you're down 197 staff by my count, and there must be a lot of salary savings that's racked up. I know they probably have a lot of overtime as well. I'd like to know, we've had a shortage of staff there for a long time. We have pretty high FTE counts. We have budget approval for a full FTE count, which we're not anywhere near that. So there's salary savings that's ongoing. And I have no doubt that the overtime is being paid for out of the salary savings from staff that doesn't exist in our department. My question is, what services are we not providing? Are we providing a lower level of services because of the staff issue? We're going to have a discussion later on, but I'm not sure that the staff, even at any price, I'm not sure there's actually people that exist regardless of the salary level. I'm not sure that you could ever hire someone to fill these positions because I don't think these people exist. And so we may have to consider, what services can we provide with the staff that we can get and with the staff that we can retain. The question is, that level of service, we've been there for a while. It may not be what we want to do, but it's better than nothing, obviously, as well. So we might need to recalibrate what our goals are here. Go ahead.
A couple of things. One is that most of the vacancies that we have are in those areas of the organization that generate revenue. So there's not really salary savings because they're not being able to offset. We don't have them to pay, but while they're not here generating revenue, so there's not a salary savings for those folks. And if we are able to pay folks and fill those vacancies, then we would be able to increase the volume of services that we're providing. We're providing all of the services that we are obligated to under our licensing status. CCBHC just did an evaluation, and we're meeting those expectations right now at the current staffing levels. But we know that there are people who are not receiving services that could. We're probably not, and there are examples where someone would probably be medically appropriate for 2 visits a month. We're able to see them once a month. We have waiting lists for services that we haven't had in the past, and we're referring folks out. So if we had more staff, and it's going to take us a long time to get, I wouldn't disagree that it's going to take us a really long time to get 97 vacancies filled. If we get to that point, we believe that there are mental health needs in the community that we could help people with if we were fully staffed. While we're not fully staffed, we are triaging and we are delivering services at the volumes that we can, even though that may not be ideal.
Let me interpret a little bit what you just said and see if I'm right. So the folks we are providing services to, we can't bill for those services because they don't have a benefit to be billed. We're providing a service, but there's no one to bill because they don't have insurance or whatever that would be, right?
In some instances, that's true too, yes.
So those folks that do have insurance and they're not coming to ComCare because we don't have a staff person to provide a service, we're not billing someone for service we didn't provide, are they going somewhere in the private sector to getting services out in the private sector somewhere?
Some may. Most of the people that have, the folks that ComCare serves are, particularly on the adult side, they're individuals who may not have resources, so they may not have insurance, they don't have the ability to private pay, and their acuity is great enough that the private sector may not choose to serve them. And so we are the behavioral health safety net in the community. And so some of those folks are getting services at other organizations. Some folks are receiving services, but at a lower rate than what they should, given our staffing circumstances.
I'm not sure what you mean by acuity in that sentence.
The level of their illness, how sick they are.
All right. That's all my questions. Thank you, Chairman.
Thank you. Commissioner Cruz?
So to that point, an example of why we need more people is there was a Sunday night a couple months ago, a volunteer called me from the Lord's Diner. There was a gentleman who was physically fine, but he was having a mental health crisis. Called ComCare, actually called Jen, and she was going to have their crisis folks go out, but they were both busy. And so this gentleman was in need of some psychiatric care, but there was no one to call I called as a commissioner to the director of ComCare, and we had to call an additional social worker. I'm not even sure where the other social worker came from to go out and check out this gentleman. So we're scrambling. People are calling us at, late into the evening sometimes to find help for folks who need it, and we can't find help. So it's an incredibly sad state, especially in Midtown, Wichita, Kansas.
Thank you. I don't see any other questions.
Okay,
We ready for Health Department?
we are indeed.
And we're going to transfer her over to Adrian. Well, this is new. Every other time you talk to us, it's about COVID.
I know. Good afternoon, Commissioners and Board of Health. And there'll be a little bit of that in there, but not a whole lot. So you'll see on this slide our workforce strength org chart. And overall, our staffing is in red. We do ebb and flow between yellow and red. I will jump to the challenges to talk a little bit more about our staffing. So it's an ongoing challenge that we have, and even prior to COVID, our primary positions that have historically been a struggle are our medical staff. So nurses and our mid-level staff, which are our nurse practitioners and physician's assistants who we are required to have to run our family planning clinic. And so, in our dietitians. And then since COVID, with inflation, we've added new levels and new positions to that we're struggling with hiring, and that has a lot to do with administrative support positions and medical assistants. So with we have 13 admin support positions in the health department. 8 of those are currently vacant, and 9 positions have been hired in the last 2 years. With medical assistants, we have 5 total in the health department with 2 vacancies and 2 hired in the last 1 or 2 years. We have 14 total nurse positions, 6 are currently vacant, with 6 starting in the last 2 years and 3 of those are new in the last year. We have 4 registered dietitian positions in WIC with 3 current vacant and 4 starting in the last 2 years, with 1 of those being in the last year. So there's a lot, we get people out of nursing school and dietitian school, train them, and they leave. And even now with our fiscal associates and our staff that are admin support at our clinic that are they're checking people in and out, we're having quite a turnaround in those positions as well. We have hired a couple, or in the process, we've hired a couple that haven't started yet. Our children's dental clinic would be green because they have 4 out of 4. We did finally find a hygienist. And our WIC program did hire, I believe, a nurse, but it ebbs and flows because with our clinic on West Central, since this, we've had an MA resign, she's going to the VA for $5 more an hour. We had a nurse resign to go somewhere else, and then one of our nurse practitioners has resigned and is going someplace else. So moving on. This is just our overall funding chart that I wanted to share with you, and shows the split between local and grant funding in our main programs. And then overall with the health department, we have 41% local funding and 59% grant dollars. Our COVID workforce strength. Now this is always changing and moving and is continuing to downsize, but I wanted to show you our workforce strengths with this org chart. Now, many of these positions are not going to be here once we get to 2023. It's going to be at least a 65% reduction. And these, the 55 through 71, for example, 77, many of these positions we won't be able to fill because they are temporary positions, even though they are Sedgwick County employees, that they are temporary positions, and it's going to be difficult to hire somebody for 6 or 7 months. So it has been a struggle during COVID because of having temporary positions, and early on, particularly the first year, we would hire people for 6 months, and then, hey, we're extending you for 6 more months. And towards the end of that 6-month period, people always start looking for a job because they need ongoing employment. And so that has been a struggle. So this will look very different even by the end of the year, and definitely into 2023 as we continue shifting to recovery and building back after a disaster, and mitigation. We'll be focusing a lot on mitigation, finishing this year into 22 and 23, and focusing really on mitigation projects to reduce further risks from whatever hazard or public health emergency will occur next, because we will have one. And those projects are all intended to improve conditions before the next event. Oops. Our next is strategic plan. So as everyone else, we created a strategic plan, and ours, we actually created it in 2019, a 5-year plan for 2020 to 2024. And so as everyone else, the pandemic hit, and so that plan is now 2022 to 2026. Our goals are still relevant, and they still tie in as they did with the county's plan. So in our planning process, we decided on activities for the next 12 to 24 months to build momentum behind our strategic directions. Then staff from all levels, from frontline on up, and partners developed 2nd and 3rd year accomplishments for each strategic directions that I'll share in a minute, by responding to the question, what will be our specific measurable accomplishments by the 2nd and the 3rd year? So the team developed accomplishments that are specific and concrete, and they are actions that have an ending point and be accomplished within a specific period of time. So our strategic goal number 1, you'll see, is strengthen a skilled and innovative workforce through professional development for in-person skills and technical training. And then our goal 2, promotes and sustain a positive work culture by attracting and retaining high-quality employees and updating health department hiring processes with HR's help. And our third is improve bi-directional internal communication and establish communication and collaboration between health department programs, because we can improve that area. And then our fourth is to establish strategic communication with and between community partners and modernize community communication. So our opportunities, so due to, and we've had a lot of, as you're very aware, infusion of funds. They are short-term, but state formula funding has been increased. It was increased last year, and then it will be increased this coming year for the first time in over a decade. And with the increase in state formula funding, I will be coming to you soon with a request to add a public health inspector, because we now need to begin doing school inspections. And we'll be requesting 2 health educators as well soon. And then another opportunity is to continue development of community partnerships, especially for our underserved areas. I did talk about our challenges with staffing and the nurses and dietitians that turnover quickly. And the turnover results, as Tim mentioned, results in an inexperienced workforce and even inexperienced managers and supervisors. The last is our 2023 budget request. For 2022, we had $18,670,173, and then for 2023, it's $13,804,434. Oh, that's Tim's. And so with that, I'll be happy to answer any questions.
Well, thank you, Adrian. I appreciate it, and I don't see any questions.
Okay, thank you.
Thank you. Tim, you going to give the summary?
I'll wrap it up with the summary. So we are at $84.7 million for the division, 3 decision packages, $4.9 million. Happy to answer any questions.
Thank you. Any questions for Tim? I don't see any questions at this time. Now we're going into the summary for the commissioners.
Yes, we have the commissioner discussion scheduled next.
Very good. Thank you. Well, commissioners, a couple things. I'm going to give each commissioner 10 minutes to discuss several things. So after hearing all the budget presentations, does any of the commissioners need any more information from staff for 2023? Let me remind you, it's 2023 we're working on. Another thing is, what do you see as the highest priorities moving forward as the manager prepares his recommended budget? And conversely, what do you see as lower priorities, those items that may be delayed in the funding? Any general thoughts on compensation? Do you support what is needed in the forecast? Is there more info coming? There is more info coming in the next couple of weeks. So just a general assessment is all we need for right now, because Sheena is going to give us a lot more detail coming up. And are there any questions regarding the CIP? So I will just start and go left to right. And Commissioner Howell, you have 10 minutes.
Well, did I have those questions before just now? Those items?
I think he sent it out. I think Tom sent it out to everybody.
Okay, well, I must have missed that. I apologize. So
It's in an email. It's in an email if you did it.
I may have, but I'm pretty busy, so
They sent out today?
Yes.
today's been a busy day.
It's a
He
busy
sent it at
time.
12:07 PM if that
Well, that's
helps
even
you to
busier.
track
You
it
know where I was
down.
at 12:07. Yeah, so I guess my point is, these are big questions, and I do appreciate the chance to speak. If I stray off of the areas that you want me to stay on, I guess just gently pull me back into the where you want me to go, but I do appreciate a chance to speak. I'm reflecting on a lot of things. We just talked about $84 million budget request. I reflect back what we did in 2015. This is probably way off base here, but there was accusations about us killing people because we weren't funding health. Do you guys remember that or not? I don't know. That was very political and very much in the news. Team, you remember that? They calculated how many people we were going to kill because we weren't funding health. I just think that, look at the $84 million request. I guess I'd like to have someone conclude that that was a inappropriate comment. We're not funding health. I think we are funding health. And there's been a lot of debate even since that day about, who's the health champions and who's, at the end of the day, we are appropriators, and we trust our staff to provide the best services for the money we can afford to provide. We are not the health experts. And so this is I guess an observation that I think we are funding health greatly. I think we're funding public safety greatly. I know there's great opportunities as well, but I think what we've heard so far in this budget presentation over the last 10 days or so, we're big parts of our budget. We are definitely supporting these as priorities. I'm approaching this budget personally as a zero-sum game. I know that some growth is almost inevitable because I think that everything costs more. Fuel costs more, insurance costs more. I think the idea of staying under a revenue-neutral rate is not reasonable in 2023. So I'll just start with that. I think we're going to see a need for some increased budget numbers over last year. I don't think there's any way to stay under the revenue-neutral rate. But having said that, I think we've got to be reasonable as well, because the people we serve are also hurting. We have people who are struggling very, very much to make ends meet, to buy. I talked to someone the other day. They said their infant child, before this shortage of baby formula, was paying $45 for a can of formula, and now with the shortage, it's much higher than that. People are struggling. I was in the process of looking for a rental for myself, and I had trouble finding places I could rent that had 1.5 bathrooms for less than $1,500 a month. People are struggling, and I think for us to simply accept much larger budgets because of the challenges we're seeing right now is not reasonable. I'm going to have a hard time taking the simple route, and that is to just blow up this budget because we feel like we have no other options. We're going to have to be a lot smarter than that this year. I have talked a little bit about the fire district. I think that we have a challenge to find a way to keep that mill levy lower than it is even right now. I'll say again, I know Mays is talking about finding ways to get out from under the fire district, and you can argue all you want to from a legal perspective saying they can't do that. We have a contract or some reason why we think they can't do that. I think that they have constitutional home rule, and I think if they want to push the issue, it's going to end up in court, and I think they win that. And if and when that happens, I think the fire district is going to collapse because we need Bel Air and Mays and Goddard and Hayesville and other communities to stay in that fire district or it begins to fall apart. I think the fire district is becoming, and I've said this before, I think it's becoming a house of cards. It looks healthy right now because we have some ending balances, but I don't see that this budget is showing vigilance to keeping our costs down. So I'm very concerned that we're continuing to simply say we're going to capture the assessed growth in our the increases in our assessed value, and just going to capture that and keep the mill levy up where it is. I think we're asking for trouble if we do that. Same time, I know our firefighters need to definitely have a raise. So I think we're going to have to be a little bit smarter around how we do this. Whether we put the money into equipment and buildings or into salary, I think that's a decision we have to make. With respect to aging, I'm disappointed once again to see that mill levy going down. I have a personal conviction that the people who spoke in 1982, when you find people in the community that need hearing aids and we can't get them, I find that to be almost a moral issue to myself. I don't like the fact that those numbers are continuing to go down. And I'll just say that I think the aging mill levy that we calculate most of that money is in our administration. I think that the ballot question was really talking about grant funds for private sector solutions to aging. I don't think it meant that we would stand up a large department of aging and consume those funds with our own department, with our own employees. And again, I appreciate what those folks do, but I would have a different vision entirely, that we would grant those funds out and we'd hold people accountable, let them compete for those dollars and hold them accountable to provide services for our community as grant funds and not necessarily have a large Department of Aging. And so that was a big part of our budget. We heard that today as well. My vision for Department of Aging is that we would take those funds and we convert those to private sector grant funds. We would have performance measures, let some competition, bring better services to the community. We talked a lot about CIP the other day, and generally speaking, I think it's a pretty good package of proposals, and I think there's a lot of things in there. I don't agree with everything in that. I think that every year I struggle to support the CIP because I don't think it's hitting the priorities the way I think it should hit them, and I think there's some things in this community that we need to focus on. I'll tell you, this is going to be a sore subject for some folks, but the R342 program that we talked about years ago, and I know Public Works doesn't like that program, I get it, and I made a comment the other day that these cold mix roads that we're converting to better roads, the reason we're doing that primarily is because the traffic levels are high enough, or those situations now warranted that we needed to have a better road. But those roads would have never been paved in the first place if it wasn't for the cold mix program that commissioners got to pick a mile used to be every year, then it was every other year. And I'll tell you right now, the roads that I have paved in the past, I paved a half mile south of Southeast High School. I paved a road, it was deemed by David Spears as being the worst road in the Sedgwick County. It was 87th Street for 2 miles between Rock Road and Greenwich, which now I understand is being under discussions being annexed by the city of Derby. So there's developments going out that way that are worth hundreds of millions of dollars that are being serviced by those roads that probably wouldn't have ever happened had we not paved those roads. I know the word earmark is a dirty word, especially when we think about Washington, D.C., because it connotates that someone's buying a bridge to nowhere. But what an earmark actually is that there's something important in my district that I understand, and there's something important in your district that you understand. And I don't think that I can get 4 commissioners or 3 commissioners or even 2 commissioners to agree with me on something that's important to my district. And so these items get left off the table. I can never get them to be fixed because politically I can't get 3 votes. So this program years ago was designed so that I can identify something very important to my district, and I know there's something very important to your district. I'd be glad to support the issue in your district if you'll support the issue in my district, and that's how that program came to be. So are we wasting money? I think as long as we do things that are very, very important to Sedgwick County, then I don't know that I'd say it's a waste of money. But I do think the commissioners ought to have some liberty to advocate for things in their district because they are experts on their areas. And unfortunately, even though I know how important some of these things are, I can never get the issues to move forward. So I know that program's dead. I'm not suggesting we revise the program, but I would just make a point that as a commissioner of my district, I have no ability to move an item forward unless someone outside of myself thinks it's important. And that's never going to happen. The issue of mental health, we talk about that for just a minute. I was surprised when we went to the Mental Health Coalition briefing the other day, and I heard that ComCare actually does mobile mental health outside of ICT-1. And only 2% of the time do they actually call a law enforcement officer to accompany them to a call. That is a tremendous statement that they made. I think that's worthy of expansion. I think the biggest thing we can do in this community, out of all the priorities that relate to mental health, that's the low-hanging fruit. ICT-1 is a great idea, but I think it's too expensive for what it provides. I'm a huge fan of mobile mental health. I think we ought to be using our paramedics to do health assessments as needed or to administer medications as needed, but generally speaking, they don't do much of that on ICT-1. In terms of a law enforcement officer, again, this mobile mental health service from ComCare is only calling for LEOs 2% of the time. So why is it we can't expand that and use the hundreds of officers that are on duty at any given time to accompany them in those moments where they need that assistance? But if you put the money into mental health, that's the low-hanging fruit. So rather than get distracted by the very, very convoluted and complex discussion of mental health and homelessness and substance abuse and the many, many other topics that tie into those issues, I think the low-hanging fruit right now is mobile mental health.
Commissioner,
And- Okay, I had one other comment, and I guess I'll save it for later.
finish it up.
My final comment would be this, in terms of compensation, we're short everywhere in the county, and I don't think that these people actually exist to fill these jobs at any price. I made a comment about that a minute ago. I think there's a likelihood we might need to recalibrate what we do. The level of services might actually stay where they are today with our lower levels of staff. We take the salary savings and pump them back into salary increases. So we can retain the staff that we currently have. And I think that's across the board in every department of Sedgwick County. So if there's salary savings and a lack of people filling the positions, I think we need to change our strategy entirely by taking those salary savings and convert that into salary increases and retain the staff that we have and provide a different level of services that we would like to do, but what we can afford. Thank you, Chairman.
Thank you, I appreciate it. Commissioner Cruz?
Thank you. So some of the things just off of today, starting with aging, would be a focus toward multi-generational type of activities. When we talk about senior centers, when we talk about the types of convergence of populations we do see around the country, there is better outcomes when multi-generational folks get together. So I'd like to really just reiterate that again. As far as our grants management, I know last year we were able to fund a grants management position. We have one person doing that? How many people we got doing that?
So we have a grants administrator position that was added last year. The year before that, we had a grants analyst added to the staffing table. We also have an Arpa grants analyst. We're using our economic development analyst to some degree to go after some of the infrastructure bill things. And then we've engaged DRS to help us stand up a more robust program.
Okay. So we do have a plan, it sounds like.
Oh, yes.
Okay, great. So that's really important because there's a lot of money out there that we just need to be able to capture and have that person who is an expert at doing that, because writing grants and finding grants is not always the easiest thing. Compensation is absolutely important for me, absolutely. I want to be able to provide quality of life to the folks who care for the people in our community every day. And so that is absolutely at the top of the chart for me when it comes to this year's budget. Thank you, Sheena, for getting the information around. If we were to able to, I think it was like 37%, we'd have to have the increase this year to get to 15% or $15 minimum wage. So I appreciate you getting that information to us. I did have some conversations with folks in EMS the other day at their picnic, and that was one thing, was being able to, they do some really challenging work, so being able to pay them is really important, but every single one of our employees, so you hear me on compensation. The next thing would be our website and the way we share information. It's really cumbersome. There's a lot of information on there, and I wonder how are people using our website? When was the last time we just did a study of how people were utilizing that site? Just trying to find something today, I couldn't even find it. And when I get questions from community members, I'd like to be able to point them in an easy direction to where to find it, and it's just very hard to find. I gather that we have a ton of information, but is it being used, and is it easily accessible to those in our community? So user-friendly, it just needs that revamp, so I'm hoping that we'll be able to get that going. As far as the CIP goes, when we talk about the amount of rent that we pay a lot of rent. And that really isn't a long-term asset for us, those buildings. And what is the benefit to having an asset, or do we just continue paying the rent? I mean, what are the pros and cons of renting those spaces? That's one thing. But then the other thing would be like the adult complex and the location. Is that the best place for the end user of those services? One example would be addiction counseling. That's all the way down on Harry. Is that the most centralized location for this community to access as a whole? And so when we think about not only the programs that are down on Harry and the rent that we're paying to be in those spaces, but is that the most centralized place in connection with the other services? So when you're talking about the court, when you're talking about drug court, when you're talking about all of the centralized location of our adult complex, and how it functions with our courthouse now and going all the way down to Harry, is that the best location for those services? So in the future, could we think about what would be a more customer-friendly way of providing an opportunity for those people to get those services? So I hope that's understood. That's obviously going to be a big capital project if it does come to fruition, so that would be a nice thing to start discussing. Along that line with ComCare's expansion, I know that we have allocated a certain amount of money for the expansion that we know as of now. But if we had to reimagine what it would be and a consolidation of services, and I know that that's on our radar, but in the entire system, is there anything else? Did we leave anything out? Like, is that the best possible expansion that we have right now? We went through one draft of a block diagram, right? Where's our second draft? Like, how many times have we scrutinized it? Who's scrutinized that plan? How much square feet do we actually need? Of all the programs that we have, is there anything else since the shovel's not been put in the dirt yet? We don't have the ground. Is there anything that we've missed when it comes to expanding that crisis center for the community at large? So that leaves me, I think, Chairman, to my last point would be the Kings County Hospital in, not sure where they're at, actually. They, in New York, they implemented a lean behavioral health initiative. So we've all heard of manufacturing and how manufacturers implemented a lean model, which talks about continuous improvement and lean methodologies and getting from place to place. This talks about how can we collect patient data to eliminate duplication of work. So for example, my child is enrolled in our ComCare services now, and as the mother of this child who is trying to get her enrolled in these services, the paperwork that I had to fill out, handwritten, was cumbersome, and it repeat questions over and over and over. So when we talk about a staff shortage, is there a way for us to have an electronic system where me as the mother and me as the provider, the caregiver of this person can enter the data, so then I don't have to hand it to our team members to then input the data? Is there a continuous improvement methodology that we could adopt, like the Kings County Hospital story? It's called Lean Behavioral Health, and it just talks about the basic principles of lean approaching how we do our systems. But then that leads me to the greater question of how are all of our systems? Have they been thought about to taking a lean approach to those systems? So I know that that's a big old elephant to bite, right? So I'm not trying to go there yet, but the vision of how we're helping our staff be efficient with their time and be able to care for folks in a better way so that People aren't getting burnt out. We have a improved process of how to care for folks. So I'd really like for us to take a good hard look at how the system in general, as far as behavioral health services that we render today, and is there a different approach that could improve how people go through the system in general that would allow and free up our staff so that they wouldn't have to do some of those tasks that are taking their time away from patient care, since we are so short-staffed right now. So I think that's it. Excuse me. I got one more thing. The co-responder model. We have in our system right now, in 911, we have 264 call types or codes. Of those, 170 are law enforcement call types. So when we talk about the number of behavioral health calls that we're getting into 911, and I know that 988 will probably maybe alleviate some of those calls, but we really don't know how many people are facing a mental health crisis when they call 911 if they do have a different code that is registered as higher priority. For example, a shooting, a robbery. Are there the underlying reasons why maybe someone has committed a crime? That code is not placed at the top, so we might not register that as a mental health call. So like we're talking about continuous improvement and lean methodologies of just patient care and how we're entering data, is there a way to reevaluate our 911 calls so that we could better capture that information? And I do have, for example, I asked Elora to check other like-sized cities around the nation, and there really isn't a one-size-fits-all around call types and call codes. And I'm not an expert, I'll be the first person to admit that, but the information that I've received when trying to figure out what is the best way to triage calls, because that's what our co-responder model is doing, right? Right now, they're cherry-picking those calls. 911 call comes in, they feel like they can handle it, and they are dispatched out, and they take the call. But if the calls came in, and we were able to handle them in an easier fashion, perhaps we'd have better tracking and know how to help those callers quicker, so that we can care for our community in a better way. So those are some of the things that I'd like to see. As far as this budget goes, that some of it's very visionary type stuff. I get that. Like, that's who I am. That's how I'm going to be. I'm not going to apologize for it. But I think it's important for us to look at our systems and how we are funding these things right now, because right now it's like a revolving door of rubber stamping a budget that is funding the things in the same way that really aren't moving the needle. And so if we want to be more efficient with our funds and have a better quality of service for our taxpayers, then we have to start thinking outside of the box in some of these ways. And those are the types of things that I'd like to start discussing. So thank you so much for the opportunity.
And Commissioner Lopez.
Thank you. Well, I can really appreciate where you guys are at on a lot of this. I know for many, many years, all of our departments have been looking at flat budgets, and that's got to be very hard to maintain that for this long of a time. And now we're pretty much asking for that again, because our number one priority has to be compensation. At the end of the day, we cannot provide the services that we're doing now, much less expand, unless we keep the staff that we have, retain them, and then attract new ones. So compensation has to be, in my opinion, number one. We talk about how much our community is struggling on any given day with all these different issues, but our county is made up of 2,700-ish people that are a part of our community, and we have to do what we have to do to take care of them and make sure that we're paying them an appropriate, livable wage, and that they realize that they are valued here. And that's the only way that we're going to retain staff, but also attract new staff to come in. So that is my number one. I think when we hear about workforce issues over and over and over, not just at the county, but, just across the board right now, we have to start doing better about attracting community members that we haven't necessarily reached out to in the past. So we need to do, like, our DEI efforts need to be improved on trying to get people who haven't thought about working for the county or for government before and engaging in those communities and bringing them in. And then being a more inclusive place to work as well, because how are we going to get people to come and stay if they don't feel welcome? So I think the DEI initiatives really go along with the workforce issues that we're having and retaining our staff. So that's really my priority going into this, is just our workforce, making sure that we're taking care of the staff that we have today, and I don't see how we grow that if we don't do that at the minimum. And then we can talk about expansion of services all day, but we're closing services down right now, so I don't see how expanding anything is possible at this moment. I hope we can get there, but not this year. That's it.
Thank you. Commissioner Meitzner?
Thank you, Mr. Chairman, and a robust discussion. Thanks for all the presentations, all the staff. It's much appreciated. Try to cover a couple things here. Obviously, I'm in agreement with, I think, the majority that the compensation, of all the things we talk about, it seems like compensation keeps elevating itself to the top, and thus, when you have the top, then that means everything under the top either suffers some or is eliminated. Anything that we can do to improve or support or fund what we call the mental health world is probably, for me, a priority. I don't know that I have my hands around the impact of the Arpa funds on the operational budgets of 22 versus 23. As we saw with Adrian's last presentation, it was whatever million less, and that was because she had a bunch of Arpa or CARES and all that. So I'm not sure it's important to really understand that, but I want to make sure that it's a true 23 budget from my perspective. That's, if I can eliminate the impact of Arpa, would let me feel a little better about operational. And I would say that, and then I don't know if we can say it yet, but if there's a sense of unused CARES that this falls kind of into the contingency world, but it's really not. It's contingency of Arpa and CARES. If we want to consider Arpa support in the 23 budget, I know we've been thought about holding it to the end of the deadlines, which is what, the end of 24 or 5?
Yeah, we don't want to hold it that long, but yes, we were going to hold on to it for a while. But I'm going to have some updates for you that are not going to make everybody super excited about some cost increase.
Well, there might be some impact there that we could utilize. I'm concerned about the impact of 988, basically the unknown, which makes me cautious on being very aggressive about other funding. And I am not a fan of depleting or severely impacting any department's contingency funds. I think before I got here, the county, I congratulate you all on your financial conservative approach for this contingency funds, and I don't mind looking into it slightly, but I'm not a fan of wiping it out unless it can be justified in the impact of our bond rating, et cetera. CIP, I'm kind of a fan of holding steady. I think our CIP for the 23 is, if I wrote it down right, it's like 10.7 million, something like that. It's a lot of money for CIP, although 7 million of it is the DNA lab. And obviously, the blocking and tackling of roads and bridges and the infrastructure is important. I don't know if it's a CIP or an operational cost, but I kind of, for some reason, leaned more heavily into the technology review report of the 1.9 million. If you recall, I asked, what was not important. Well, I couldn't get everyone, all were important. And I asked what was not included, and there was only like 2 items. But if that is necessary for us to keep up with, I'm concerned about cybersecurity a lot and all of that thing, Mike, that you and your group does. So I am reluctantly supportive of that expense. Again, I'm not sure if that's CIP or if that's operational. I think it was operational, if I'm not mistaken. So in summary, I think the last, we've done a lot to all the various terms that Sheena came up with: emergency pay, stick around pay. I don't know what all the pay. Anyway, I think the employees, hopefully, and the managers know that we've been doing a pretty supportive job of trying to get some caught up and still behind. So I understand that. And because for anybody that's watching, obviously, if we can keep services, meaning paying our employees, they're hired to serve the 500,000 people in this. So the citizens benefit from good services, and so it's kind of a trickle-down effect. But I'll note that the county commission salaries have been, well, we've actually got a policy now where we're not getting a raise unless we vote for one. So we will not getting raises unless the 3 members want us to get raises. And I think senior staff was maybe frozen this year or not. No? Okay. So anyway, again, and a part of me, in closing statement, part of me, we talk about the employees and all of the services and the shortages that we have, go to sheriff, 911, all that stuff. So we try to help them, which helps the citizens, but one that's kind of left out in the dark a little bit to me is the actual taxpayer, the property taxpayer that contributes to this. I know we'll have the final numbers coming in sometime, and if the final revenues are from the assessed valuation are greater than maybe expected, and if we want to consider using the value of the assessed value increase, I would like to consider rewarding the taxpayers themselves with some consideration of a mill levy decrease combined with everything else. And I think our employees can understand that if they're going to get a raise and they've been getting compensated and we're serving the community, and if the taxpayers can get a mill levy decrease of some kind, then that shows that I think we're all in this together and appreciated. So thank you for letting me make these statements.
Thank you. First of all, thanks to all the commissioners for their attention and the questions as we've gone through this process. Thank you for the staff for all of the presentations and the information that you've provided. I appreciate it. A couple comments. First of all, I think compensation is the top of my list. We have to be able to retain the workers we have today. My biggest worry is that if you look at the unemployment rate right now in this area, it's about 3%, somewhere in that vicinity, and probably most of that 3% we wouldn't want to hire if we wanted, if we even had an opening to put them in, because they're unemployable. And I hate to say that, but there are people out there that are unemployed for a reason. So we truly have to recruit the best and the brightest, and that takes compensation, and we have to retain the people we have. So that takes compensation. Inflation is a big worry, and that's another concern that I've got on retaining and recruiting, because right now we're here at somewhere 7-8% inflation rate. And so our employees are going backwards on their buying power. So I think that we're going to do something this year, and we're going to have to follow it up with something in the 2023 budget. I look at the entire organization, and I know that we've got a lot of different electeds in the organization also. What concerns me is bonuses that are paid by some of the electeds at the end of the year, because they don't realize the ripple effect that that has across the rest of the organization. So if we're going to give large pay increases across our organization, I would hope that our other electeds would understand the impact of them unilaterally taking cost savings and providing end-of-year bonuses. So I would be very disappointed if that happened. Now, as I look through some of the different briefings that we received, first of all, the election office briefed on some items. One of the things that they talked about was sending out a mailer to everyone. It's not required by law anywhere, and I would not fund that. I don't see any reason to fund things that aren't required right now, because we have so many things that we have to fund and that are required. If we look at the fire briefing, they want to add a training officer. I think that they're looking at one probably above the pay grade that I'd be interested in, and they're also asking for a vehicle. And I have no understanding, I should have asked the question at that time, why that they need a vehicle to go over to the fire training center and sit there and train someone. So I probably would not vote for that. And if we do add a training officer in the 2023 budget, I would say that it's a one-year test, because if we have nothing happening in consolidation, I don't see any reason for us to continue down this path. I am very disappointed that I've been pushing consolidation since I got here and nothing happens. So something has to start happening, or I'm going to start pulling back. MAPD did brief on one package that they were interested in, and what I don't understand is whether or not that they've cleared that through WABA, because the funding is coming out of WABA. So before I would ever approve that, we have to make sure that WABA weighs into it. We are moving out of this building and turning it over to courts. We're adding a lot of additional items for the courts, and if we're going to do that, I hope the courts reciprocate in something that we've asked for over and over again. I'm pretty sure they will, but I just want to reiterate that Veterans Court and a mental health court are two things that are at the top of my priorities for us to be able to move forward to supporting the courts. We saw several FTE requests in the budget requests as they came across, but I don't understand FTE requests when there's a whole bunch of openings. So I don't know that I would support any FTE request above what they've got now, if they've got 10, 15, 20 openings, because all it does is add to the budget, but we're not going to fill them. And so once we get to full employment, then we can talk about additional FTEs. But right now, I don't see too much reason to add FTEs. And then at the top of my list, besides public safety, is mental health. And so as we keep moving forward, we've got to keep working on how that we can solve the mental health, substance abuse, homelessness problem here in this region. We've got a coalition that's been working on this. We've had a couple of en bancs dealing with it, and we've got to start coming up with some solutions as we're moving forward on that. So those are kind of the highlights that I have as we move forward. The CIP, the only thing that other than one thing I've already mentioned on fire was there's a dream thing at the end of the CIP that says, hey, we want a storage building for fire trucks. We've got plenty of storage across this entire county. I can't even understand why that you've got that as a dream thing in the future. I'd delete it completely out of the CIP. It does not make any sense when we got plenty of places to store vehicles. So those are the things that I saw off the top of my head. I got this briefing, this request about the same time as everyone else did, so these are the things I thought about as I went back through. So anyway, the staff, Lindsay, do you or Lorian have anything that you have questions of the commission before we adjourn?
I think my only question is, would there be a need for any additional workshops than what we have already scheduled? If you remember, next Tuesday, we have the ComCare new funding model, along with the Mental Health and Substance Abuse Coalition requests. Then we will have a workshop on the compensation discussion. Then we will have a workshop on the Sedgwick Lofton Task Force recommendations. So your schedules are very, very tight. And so if there are additional workshops that you would like to have, if you could let us know soon so we can try and get those done. If you remember, June 15th, so less than a month from now, is our deadline for making all decisions for what goes into the county manager's recommended budget. So we'll be in your offices quite a bit, I'm willing to bet, the next few weeks.
Oh, good. Well, compensation workshop and Sedgwick Lofton's workshop are two critical ones. I don't know any others. Do any commissioners have any other ones that they'd like to have? I don't see anything right now. Lorianne, do you have anything? I know that Tom Stoltz has been on the line the entire time. I hope he's feeling better, but do you have anything that you'd like to add, Tom?
No, thanks, Chairman. I've got writer's cramp. I've got 3 pages of notes here. I appreciate the comments from commissioners. We'll convene as a staff after this and begin to work on some of the items you brought up. But I appreciate everyone's comments today.
Very good. Well, each one of the commissioners will meet individually with your staff, and then we look forward to what we have for the manager's budget coming up. Hey, anyone have anything else to come up for the commission during this workshop? Seeing nothing, it's Friday afternoon. Have a good weekend. Thanks, everyone.
Another year in the books.
Lindsay, one of those